Okay. So is the scenario visible, Dr. Sheikh?
Yes, sir.
Okay. So when is your exam, Sheikh? You are from which place?
Sir, I'm from Karnataka, Bangalore. I have still not scheduled for the exam, but I'm planning to schedule it for this Diet 3 in India, sir.
Okay, good, good. So you are practicing now? You started
Yes,
practicing.
yes, sir.
Okay. So how long it has been like practicing?
Sir, it's been 4 years since my post-MD, sir.
Okay. No, this for MRCPCH, how long you have been practicing as a group?
Sir, this clinicals I have just started, sir. The AKP I have cleared in this January session, sir.
Okay, good, good, good. Okay, pa. So we will give you. So you know the format, right? So you will be having now 4 minutes outside. So you will be having the scenario. So you look into the scenario. Okay, I'll start. Then you will have 9 minutes plus you will get a bell. Then another 4 minutes. So 13 minutes you can take the history. Then finally 9 minutes of discussion. Is it okay, Dr. Sheikh?
Yes, sir. Yes, sir.
Okay. If you want, you can on your camera also. If
So
it is
this
okay.
the broadband, it is not on broadband side, it is on my mobile Wi-Fi.
Okay.
So that is why I had kept it
Okay.
on the audio so that the link should not get broke.
Okay. Okay. Sharif, you take your 4 minutes time.
Okay, sir.
Okay. Dr. Sheikh, you are ready?
Yes, sir. Shall we start, sir?
Ah. Okay.
Hello. Am I talking to Mother of Hari?
Yeah, doctor. Good morning, doctor.
Yeah, good morning. I am the specialist registrar here in the district hospital here. So is it the right time to talk to you?
Yeah, doctor. Yeah.
How may I address you,
You can call me as Hema, doctor.
Hema? Okay. So, Hema, it's nice to meet you. And I can see that you're a very keen mother. You have come to me for the, I will address your concerns, whichever they are. I have just read the GP letter.
Okay, doctor. Okay.
So, may I ask you, Hema, what are your concerns with respect to Harish?
Yeah. Yeah, doctor. I'm really concerned that Harish is not growing well.
Okay.
He is already a known case of Downs. We
Yeah, I
have
read
been
that.
taking
Okay.
uh, we have been taking good care of him. I
Okay.
know that he grows a bit lesser than other kids. We even
Okay.
have separate charts. But
Okay.
recently, last 6 months, he is not growing well, doctor.
Okay.
Last 3 months, it has been even worse. In fact, he has even lost weight, doctor.
Okay. So
Lost all.
since it's been since 3 months.
Yeah, doctor. 6 months, he has not been growing well. Last 3 months, he has even lost 2 to 3 kg, doctor. That's why I'm
Okay.
very worried.
Okay. Previous to that, how was he?
He was fine, doctor. He was growing according. We have separate charts for him. Accordingly, he was growing only, doctor.
Okay. So you were having the scheduled follow-ups with the GP?
Yeah, doctor. We regularly follow up with the GP, and now he even did some blood test and all, but no improvement, doctor. We couldn't.
Were there anything specifics they told you? Did anything come up on the results, blood tests?
No, doctor. The GP blood test said nothing much, doctor. Nothing much.
Okay. So, when did you came to know that Harish has been diagnosed with Down syndrome?
At birth itself, doctor, at birth when he was born, yeah,
Okay.
he looked a bit different, doctor. Then
Okay.
the doctor and said that yeah, the features looks like Downs, and
Okay.
it came as a shocker for me actually because we did all the blood test, everything went fine. I don't know why, doctor, why that happened, doctor. In spite of everything was went fine, they did test for Downs also.
Yeah. See, but there are, I can understand your worries and concerns. And I really appreciate that you have been taking care of Harish very nicely. So, see, actually, the Down syndrome is it's not like it's run in the families. It happens spontaneously. Okay, so it is because of the we have a certain specific set of chromosomes, and when extra chromosome comes in, that's a chromosome is like a genetic material. We take half from a father, half from the mother. So when the additional set of genetic material comes in, then there are issues. One of them is like Down syndrome. So not to be worried, we like now due to the advancement of the technologies and all in the medical treatments medicinal, we have been taking care of the Down syndrome kids. And as you have been doing it nicely, you even know about the separate growth charts. So he has been doing well, right? Since 6 months he has not been doing well. So
Doctor.
what are the changes have you made since from previously from 6 months? Have you changed his diet, or what change in his behavior have you noticed there? Like, is he not having uh, in appropriate quantity, or is he having it but vomiting? What are the additional new symptoms have you seen him?
Nothing new I have changed, doctor, recently, but maybe some tummy pain. Maybe I did mention he actually had diagnosed as celiac disease, doctor, at 2 years of age. He was
Okay.
diagnosed with celiac disease, and
Okay.
but we have been very strict, doctor. So we have avoided gluten.
Okay.
So we have been on a strict diet. Maybe once in a while he takes this cakes in a month or so. But otherwise we have been strict. I don't know why. Recently he had maybe one change, some tummy pain and some loose stools for the past
Okay.
3 months.
So his feed is being supervised, or how is it? Like you particular who all take care of his feeds? It's only you or your partner as well, or
Yeah, yeah, doctor. I also take care, and sometimes whenever my partner is free, he also takes care. We
okay,
have been a bit strict with the gluten part.
okay,
Any occasionally he cries for cakes, and that time alone we give doctor.
okay. So this part you have like whenever he cries, you are giving him the diet not prescribed by the doctor, right? So this has been happening since past 6 months. Since then only it is been going on, like he's losing weight and all.
No, doctor. It has been like this routine from start only.
Are there any additional
I
are
cannot
there,
put it as exactly this 6 months. I think
okay,
before
are
also.
there any additional complaints like he's having diarrhea and vomiting as such?
No vomiting, doctor. Some loose stools is there.
Okay,
Every day, once or twice, he goes extra.
okay,
Will
o-
that cause such a weight loss? I am not. Uh,
okay. What all diet you are giving to him? May I ask
we
this, please?
we have a strict gluten. The list which have been given: rice, corn. We avoid the wheat, rye, barley. They say so that all we are avoiding, doctor. We are
O-
giving lot of vegetables.
Okay. So, when did you have a visit with the nutritionist regarding this?
Regularly, whenever we go for the follow-up, doctor,
Okay.
we have annual checkups. Then 6 months once we meet the nutritionist. So they emphasize we follow the doctor as
Has
well.
there been any, has there been any medication given to him regarding celiac disease?
No, doctor, no medications. Only the nothing like that, sir, doctor.
Okay. Okay. Only there is a diet control, right?
Yeah, doctor. Yeah.
Yeah. So, how is he on development scale? How is he doing?
Yeah, doctor, you know the Down syndrome, they said he is a bit slower.
Agreed. Agreed.
But we are taking care, we are doing the physiotherapy, occupational therapy, speech therapy.
Okay.
But still, he is a bit behind the other kids. Socially, he is a happy child. And language wise, also, he is a bit slow only.
May I know? Yeah. Okay. Fine. So,
Improving.
how is he like? How is he in walking and like? Does he walk on his own or does
Yeah,
he sit on his own?
yeah, doctor. Now he walks well only.
Okay.
He,
Since
he,
when?
he doesn't mind, maybe he doesn't run much often, but he walks well, doctor.
Okay. What about his jabs? Have you taken his jabs regularly?
Yeah, doctor, we take all the jabs.
Okay. So, how are you coping up with the care of Harish, Hema? Are there any support groups you have enrolled yourself into?
Yeah, doctor, we are part of a support group. They are supporting as well. And we are taking cheerfully only, doctor. We have accepted it actually. After all the counseling, we have accepted it. And we are taking good care of him.
Okay. And how many children do you have, Hema?
Two more elder girls. They're all fine, doctor.
Okay. So,
They,
do they help in taking care of Harish for you?
yeah, yeah, doctor. They help a lot.
Okay.
They
And what
take
about
care
your
of.
partner?
Yeah, doctor. He is a software engineer. And
Okay.
whenever he gets time, I left my job to take care of Harish. And whenever he gets time, he contributes, doctor.
Okay.
9 minutes up, 9 minutes up.
Yes, sir. So, you used to work before, right?
Yeah, doctor, I used to work before.
Okay. So, how many members live with you as of now? Partner, you and your kids, and Harish, right?
That's all, doctor. That's
Okay. Are there any particular allergies you want to tell me about Harish?
he doesn't have any allergies, doctor.
Okay. Any drug, any medications you are giving to Harish?
No, no medications, doctor.
Okay.
Except he had some ear infections every now and then.
Okay. So, what have you done regarding them?
Once they inserted a grommet also because of this ear infections.
Okay.
Otherwise, no medications.
Okay. So how is his hearing? Like, is it on par with the peers, or is it
After the Gromet and all, I think he's better, doctor.
so no use of hearing aids as of now, right?
No hearing aid, doctor.
Okay. And what about his speech? May I know, Hema, in detail? Like, how is he in his speech?
Yeah, doctor, he speaks well. He understands well. Yes, sir. But speaking still, he cannot fluently speak, doctor.
So he's catching up.
Yeah, yeah, yeah.
Okay. So, since this currently I can see the chart, Hema, the weight, his weight is around 25th to 50th centile. So weight is not that affected. It's on the milder scale, but height is quite affected. It's on the 0.4th centile.
Yeah, doctor. Yeah.
Yeah, that is we have to look it into. Don't worry, I will address your concerns. Have you got his blood investigations? Anything done recently?
Recently, the annual checks 6 months back we did, doctor.
Did anything come
Everything
on
was
that?
fine, doctor. They did the thyroid. Thyroid was okay.
Okay.
Celiac, the antibodies are not raised. So
Okay.
the vision and hearing are okay only, doctor.
Have you been in touch with the consultant, gastroenterologist, pediatric gastroenterologist consultant regarding celiac disease?
No, doctor, the regular checkups with the pediatrician. Actually,
Okay.
he didn't have any bowel symptoms, doctor. Only the antibody came positive.
Okay.
And after that,
No, as you have been doing well on this diet chart, so more, the symptoms were not there.
yeah, doctor. Yeah.
Yeah. Yeah. Okay. So, were there any complaints regarding his chest, any pneumonias, any previous admissions regarding his illnesses?
Yeah, doctor. Once, he had this heart problem. So for that, we admitted and device closure was done because he kept getting again and again this cough cold. So at 2 years of age, device closure was done, doctor.
Two
That
years
was
of age.
that
Okay.
was
And
the
the
only
same,
advice.
okay. And the same age celiac disease was also diagnosed, right?
Yeah, yeah, doctor.
Okay. So, soon after that device closure, how is he, like, what the symptoms which were there previous to the device closure, like breathlessness and all, that has,
Far much better, doctor. The number of
okay. He's
infections.
not having, he don't feel restless while feeding, sweating and hurried breathing,
Now he is okay,
choking,
doctor. Now he is okay, doctor.
choking, vomiting, nothing like that, right?
Nothing like that.
Okay. And he's not easy puking the quantity of food what you are giving him. Have you noticed this?
No, doctor. He doesn't.
So the amount which you are giving him, he is digesting it appropriately.
Yeah, yeah, doctor. Yeah. 13 minutes up. 13.
Okay, sir.
Okay, fine. So, do you want to summarize?
Yes, sir.
Okay.
Sir, here is a patient named Harish, 7 years old, diagnosed as a Down syndrome. Came today with a referral letter from the GP regarding concerns of his growth chart, falling centiles in the growth chart. And he had been uh, in touch with the multidisciplinary team of auditory, speech, language, and he has also been diagnosed with celiac disease at the age of 2 years, and he also was operated for the congenital heart disease at the age of 2 years, for which device closure was done, and he had been having recurrent ear infections for which he had been evaluated, and grommet insertion was done for the same, and they have been following the celiac disease growth diet chart appropriately. But since past 6 months, the child is falling off his centiles in the growth chart. For weight, he is currently lying between 25th to 50th centile, and the height is on the 0.4th centile.
Okay.
My diagnosis would be celiac disease, sir, as a first DD, and second DD would be reduced intake due to exhaustion of the carer.
Exhaustion of the care, Appa.
Like the mother is exhausted by taking care of the child, so most likely she's not giving much of a care to the child, so that is leading to his reduced intake, could be. And third one would be malabsorption due to celiac disease, again.
So to
And
substantiate your 2 points, did you get it in the history? Is to like reduced intake,
sir,
like
the
exhaustion.
yeah, the mother was telling, like, she was when I was taking the social history, psychologically she was quite, she sounded depressed, that despite taking care of the child is not gaining weight. She has been, according to her, she is feeding well. She is following the celiac diet chart properly, but still the child is not gaining weight. And the husband, she has and she has quit the job to just to take care of the child as well. So I suppose my second DD would go for.
Okay, okay. So how do you want to
And
proceed?
third would be, sir, iron deficiency anemia, which we see in
Okay, okay,
Down syndrome kids due to lack of nutritional deficiencies.
okay. So how do you want to evaluate this child?
Sir, I would like to first, I would like to send his CBC along with peripheral blood film to rule out iron deficiency anemia. And then, secondly, I would like to send his urea and electrolytes, and his ferritin levels as well, and the tissue transglutaminase antibody again, sir, for his as he is also already diagnosed with celiac disease, to look at the levels of the antibodies. And I will also, as he's already been on celiac diet chart, so I would like to take a biopsy of his small bowel, sir,
Okay,
because if he is gluten free, then I would like to see his how his bowel bowel histology is.
okay, okay. How do you want to treat this child
Sir,
now?
I would like to plot him on the growth charts of the Down syndrome first, and I would like to take the previous readings also, since when he is falling and how fast he has fallen, and whether the weight and height both are affected, or only weight or only height is affected. And also, I would also like to take the measurements of his head circumference along with the weight for age and height for age and weight for height charts. And I would like to also take mid-arm circumference for him and plot on the chart. And if uh, and I would also like to involve the consultant gastroenterologist for the management part of the celiac disease in him, whether it is up to the mark or whether he requires any further interventions. And also, I would like to chart his nutritional intake. How much calories is he taking, and throughout the day, according to his. And I would also like to compare it to the ideal calories what he should take at this age.
Okay. So, what multidisciplinary team you want to in other than the gastroenterologist?
Sir, I would like to plot his. I would like to take an opinion from endocrinologist, because these children are also prone for diabetes mellitus. So I would like to check his fasting blood glucose levels and involve the endocrinologist, HB along with HbA1c. And I would like to take a opinion from consultant gastroenterologist, pediatric gastroenterologist. Along with it, I would also like to involve the neurologist, pediatric neurologist, to see whether his swallowing and digestive part, how it is, like whether he is able to coordinate the swallowing part when the mother is feeding. So, because these children are also prone for gastroesophageal reflux. So I would like to see that. And I would also like to involve the speech and language therapy, as the child is still lagging behind. So I would like to know how his milestones are, how far he has been behind the usual Down syndrome people, how they attain the milestones and how he is attaining. And depending on that, I would like to involve the speech and language therapy team.
Okay. What all annual checkup do you look for in Down syndrome?
Sir, I would like to advise the mother to go for blood glucose checkups to rule out diabetes, as they are more prone to develop them, HbA1c and fasting blood glucose and postprandial blood glucose. If any of them is impaired, I would like to go for OGTT. Then I would like to advise them to go for annual thyroid screening and eye checkups with the ophthalmologists and hearing audiologist to just to see the hearing. Is there any hearing loss we are appreciating in the child? So that it should be picked up at the early and we should treat him at the first. And thyroid, diabetes, and this, and endocrine logist also for the pancreatic involvement, pancreatic function tests, and the gastroenterologist. And also, I would like to advise them to do the celiac antibodies annually, sir, as he is already diagnosed with it. And is already treated for the congenital heart disease. So I would also like to do an echo for him, sir. Follow-up echo.
Okay. And could you tell me about evaluation of celiac disease? How do you go about?
Sir, we will first go for the tissue transglutaminase antibodies. And if they are more than 10 times the upper limit of the normal, then we go for the treatment. If they are uh, unequivocal, then equivocal, then we will go for the
Hello? Hello? Dr. Sheikh, are you there?
His voice has lost.
Okay. Almost, I think we finished off.
Sir, am I audible?
Ha. Last 30 seconds you are there.
Yes, sir. So, sir, uh, first I would like to go for the antibodies level, sir. If they are more than 10 times, then I would brand it as a celiac disease and I will start treating it. And if it is equivocal, then we will go for the small bowel biopsy and I will see the histology, sir. And if the histology is confirmatory, then I will start again with the celiac disease. If the histology is also normal, then we will try to keep him on a follow-up, sir. Otherwise, we will give him a gluten challenge, sir. And again, we can do the small bowel biopsy, sir.
Good. And how do you diagnose Down syndrome at birth? What antenatal advice you want to give to the mother? Final question.
Antenatal advice in the diagnosed Down syndrome kids, sir.
Now she wants to conceive again. So what type of advice?
Sir, I would like to tell her to go for the karyotyping in the through chorionic villus sampling or amniotic sampling.
Okay.
But as it is, if it is not due to, if it is only due to meiotic disjunction, non-disjunction, then it's okay. It is not, the second child will not carry any risk. But if it is due to mosaicism, then we have to look into that. It might be inherited, sir.
Okay. Thank you. So over. Actually, history station is the most toughest of all, so you tend to interact a lot with the examiner. So, Dr. Sheikh, how it went for you?
Sir, I don't know. I have presented it for the first time. And I just came to know the timings also in the when you said me that you have selected me for the presentation. Then I went to and looked into the books that how the timings will be for the history station.
Okay. So now you are starting. Actually, for a beginner, I think you did well. So, what's your reflection, Sheikh? Like,
I need to improve, sir, in the while asking the questions regard relevant questions in the history, I guess, sir.
okay, good. Uh, we will start with others. Let me stop the share. So, what's your all opinions? You have been listening. Um, so, anything you want to add? How it could have been improved?
Hello.
Hi, Kabir. Good
Yeah,
evening.
good
You're fine.
evening. Yeah, I'm fine. Thank you. Okay, thank you so much for the session. And I want to congratulate Dr. Sheikh for this wonderful attempt. If he said this is his first attempt,
Yeah,
I
for the
believe he
first
has.
attempt, it's good actually.
Actually, he did very, very well. I enjoyed even the discussion. He has the stuff he knows, just some missed up in some places. But I would want to advise him on how he started the conversation. I think he didn't appreciate the setting. It was outpatient, but he was sounding like she was a bit depressed or something. He was saying he appreciates how keen she is for her to come. I'm not sure if that is a good introduction for this kind of setting. But I will allow you to maybe comment on that, because I was thinking maybe he was considering this as a communication station. Yeah. Then during the history taking again, there was a point that he took almost 1.5 minutes or 2 minutes reassuring the patient, telling her that this is in explaining Down syndrome for her, when that's actually not what they came for. And they already know Down syndrome, and that is not, this is history taking. It's not that she raised concern that she doesn't understand the condition. So I think that was unnecessary. He explaining the Down syndrome at that point instead of taking focus history. Then, although he understood the whole concept of the nutrition, but in history, he tried, I think maybe he should have dug more on the nutrition, the feeding, like he could ask exactly how quantity, frequency, in 24-hour dietary recall. This could have added, although he discussed this in his discussion, but this should have been explored in the discussion. I think by Allah, Dr. Sheikh, I really appreciate what you did, and discussion of Down syndrome. I think we all have to read it up, but I think what the information you gave is wrong. That if it's mosaicism, then there is high risk of there's. I don't think that is correct. I think with mosaicism, in fact, the chances of recurrence is much reduced. Is when there's translocation and both parents have translocation, then there's increase in the recurrence rate of, I can't recall the percentage, but if there is 21 translocation, that is the only situation where there is 100% risk of recurrence. But by and large, you did very well, and I really learned from your practice. Thank you.
Thank you, Kabir. Thank you. Dr. Sheikh, you got all the feedback?
Yes, sir. I heard Dr. Kabir. It was much appreciated, sir.
Yeah, I think that's valid points, whatever he has said.
Yes, sir.
I think if a child is not growing well, not gaining weight, I think probing more in the nutrition is an important, it comes.
Yes, sir. Agreed,
how
sir.
to go more into the nutrition, we should accept that. And and regarding this communication, actually, the parent, that scenario was there. She was upset because why it was not picked up. So whenever she sees a doctor, she talks. So there you could have just reassured a point or so, and you could have moved, because there we will be looking into your communication skills also.
Yes,
But
sir.
at the same time, we cannot use it as Kabir said, it's as a communication station. So
Correct.
we'll be assessing your communication skills, but you have to move on to the focused history. So there,
Yes, sir.
maybe you could have said, no, all tests are not foolproof. Sometimes it happens, but we are here to support you, and you move on. Rather, because Down syndrome, she knows everything about it, as Kabir says. They
Yes, sir.
know about the things, no? Anybody else wants to?
So the format was okay, sir? Did I checked all the
I wanted to ask what was the reason of his falling centile, whether it was leukemia or something?
Yeah, I will come to that. It's the it's the
Because I think
suspense of
he
the
didn't touch
story.
that point. He remained in the celiac.
That's the suspense of the story. So let all give their.
When will you gonna break the suspense?
Anybody else wants to give feedback, then I will tell it.
I just wanted to add one thing. In the background history, it shows that this child is more of a chronic malnutrition. Since the height is 0.4 and the weight is, 25 to 58 centile, that seems to be good. So it is important to ask whether the child had always maintained this particular height percentile, or when was it, because one can't reach 0.4 centile in 6 months. So it must have been something that was long lasting and was not picked up, or so that was something that should have been explored, because basic in any case of short 6 months history of not going well, we will have the weight low. There'll be dropping of the centiles more in the weight than in the height. So this is quite unusual that the height centiles are there. That is what my point is.
Yeah. So you maybe they might have been on the lower side from the start.
But this was not asked in history whether this height centile has been throughout is like low as 0.4 centile, or it was better earlier and then it was like
Right from the start, whether this pattern was following, I think we can ask that.
And also a proper systemic review was not done in the history, as I can see. There is no history of asking any history of increased thirst, polyuria, polygypsia, the one that we used to rule out diabetes, and other systemic reviews.
Yeah. Tanushree, actually, doctor has nailed it. Dr. Sheikh, you wanted the answer, right? So that's there
Yes,
is the system screening.
Pardon, sir?
So the answer lies in the system screening.
Yes, sir. Yes, sir.
You didn't ask all the system screening, no? So that's why you missed an important information in the history.
System screening, I didn't get, sir. Like,
So we try to tend to ask questions for each system, right? So
yes, sir.
neurology, cardiac, abdomen, respiratory, then
Yes,
close
I didn't ask. I asked for cardiac, sir, respiratory. Yeah, and
That's the
ENT and
important point in history, actually. So during that time, you make sure that you touch all the domains.
yes,
You
sir.
don't
Yes,
leave out, because vital information will be there, which will be important for solving the history.
yes, sir.
Here actually the thing which I kept was in the endocrinology. So had you asked, because thyroid is very common, right, in Down syndrome.
Yes, sir.
So
Although he mentioned that the
Mm.
diabetes, the thyroid problem, and this anemia, they are very common in Down syndrome and celiac disease. But then he couldn't go that way. He didn't
Yeah.
ask about this polydipsia and polyphagia and
Yeah.
this polyuria thing.
So there, had you asked about any swelling in the neck, or
Yes.
any sweating, or any heartbeat increasing, any tremors? So that's common, right? You can get autoimmune thyroiditis initially, the increased thyroid, and later on you will have the hypothyroid
Yes, sir.
phase.
Yes,
So
sir.
here what has happened is the child started having that initial phase where some amount of loose stools was happening because of the increased thyroid. Because she was saying that my control was bang on. So I've been giving
Correct,
separate.
sir.
Had asked the family history, food. So she was cooking separate pot for the child actually. She was so much careful, but still that loose stools was not fitting. So the endocrinology screening, no? So there, the history of the sweating, tremors, neck, and heart racing. So all those I would have given. Had you just touched, do you feel anything in the neck? Do you feel?
Agreed, sir.
I would have given that. So that's the important thing in history. Uh, you should not miss on any important domains. Make
Yes,
sure
sir.
that you
Especially,
ask all the questions in the
yes,
system.
especially in Down syndrome, sir, we have to check, I guess, all the systems.
Yeah.
Yes. Thank you,
And regarding pattern, so we have a complaint that needs to be elaborated. I think had you added the diet history, it would have been elaborate part. So
Okay,
that's
sir.
fine. System screening, as we said, 2, 3 systems you did. We need to add further all the systems. So make sure that you ask questions from all the systems.
Okay, sir.
Past history. I think any straight away asking any history of any operations, any admissions, like I would have given the heart disease. So
Yes, sir.
there somehow you uh, got it,
I
but
asked, sir. I asked regarding
yeah,
the
yeah,
previous.
yeah, you got it there. So we need to be careful with that. Development, you did ask, maybe uh, it was elaborate, but development you did ask, immunization you did ask. Birth history, you could have asked further, especially the age of the mother. Those things
Yes,
are
sir.
important.
Yes, sir.
So, what was the age of the mother? So that's right. And newborn stay, whether the baby had a stormy course in the
Was
ICU,
he an ICU graduate? Yes, sir.
that part.
Yes, sir.
Otherwise, the economy you didn't touch, right?
Sir, I asked about
In
who
fact,
all are
you
working and how many of you are staying and
whether
whether
the
since
income
how
is
long you're not working also.
satisfactory.
I
I
didn't
think
ask that. In particular, direct question was not there, sir.
because here once they started preparing the celiac diet, it became a bit tough for
Yes,
them
sir.
to manage the expenses. So because why it's important means in the management planning, you have to support that also.
Yes, sir.
So you have to tell that I will be taking social support so that he gets the economical support. So
Yes,
that's
sir.
very important. Then always ask one question: what is your biggest concern?
Concern.
And is there anything which you want to mention at the end so
Yes,
that
sir.
will help you out many times? Because even in my exam, I got arthritis. So I was asking all, and finally, I just asked, is there anything which I missed? So then she came out and said, yes, my child's eyes have been red for a while. So that uveitis,
Sir.
I couldn't pick up initially, but she gave the clue at the end.
Yes,
So
sir.
important. And in the comments part, I think gut issues at birth. I think that's what the neonatal part we should elaborate with because it's Down syndrome, right?
I had asked him or her regarding the vomiting part, sir. Easy
Yeah.
vomiting and all to rule out pyloric stenosis and the duodenal atresia. I had asked, sir. So when you said no, he's not vomiting, then
Okay.
I
And so what were your DDs to start with before asking questions? You would have had something in mind before
sir,
starting.
my DDs were when it was a case of Down syndrome.
Not
Then
gaining weight.
yes, sir. So then I had thought of reduced calorie intakes at first.
Okay, good.
So that was one first DD. Second, as they will have the complications in GI, celiac disease, malabsorption. I mean to say malabsorptions. So reduced intake was the first one. Second one was malabsorption, sir.
Okay.
So
So
third one was diabetes, sir. New onset diabetes.
okay, good. Diet, diabetes, celiac. Plus some more. That's what you have to expand your DD so that you
Yes,
not
sir.
miss out. So thyroid, had you kept no
No,
Down
sir.
syndrome.
I didn't, sir.
So when you go enter inside, this is my problem. So I will keep 5 DD in my mindset. Then
Right.
you try to probe, no?
Sir,
So
the reason was I asked in the history, but I still didn't keep it in the DD because I thought if she was telling like we have been regularly screening him with all the tests and we have been with the multidisciplinary team regularly. So I thought if it was thyroid, it would have been picked up by now.
okay.
So that
One
uh,
more important you should keep is malignancy. Like
yes, sir. Yes, sir.
diabetes, a child who is losing weight.
Yes,
No,
sir.
I think. Did you ask about fever?
No, sir. I didn't.
So the general symptoms also is very important. So
Agreed, sir.
malignancy is a very important DD in a Down syndrome child. Plus, have you explored about possibility of abuse, neglect?
No, sir. No, sir.
Actually, it
Neglect,
was more of,
I did, sir. Because I asked who all are taking care of your kid. Are they helping? Are the others helping and all? That I asked, but abuse I didn't ask, sir.
and regarding the discussion part, straight away taking that the mother was, it's a bit of extrapolation. I didn't get anywhere that mother is a bit depressed, and that's
Okay,
why. Um, but otherwise, okay.
I would like to ask you, this is often the examiners say, have you taken in abuse and neglect? But exactly what questions to ask in the history that will give us opportunity to reach the diagnosis. What questions could have been asked by Dr. Seth for abuse or neglect? Like, what are the questions that
Okay.
he could have asked?
abuse or neglect.
Dhanushri, actually a bit, I'm not able to, not a bit clear actually.
Professional field को detail में
What questions could have been asked in
बोली मेरा जॉब
to
मेरा
identify
हस्बैंड
if he
काम
has
कर रहा
abuse
है
or
मैं ये
neglect?
पूछा था मतलब मैं कुछ नहीं बोली लेकिन कितने पैसे कमा रहे मैं एग्जैक्टली नहीं पूछी एंड और एक
Okay.
डाउन सिंड्रोम का मैं किडनी की सिस्टम
You can message it, Dhanushri.
बीडी
A
में
bit
मैंने
voice is not
सस्पेक्ट
clear.
करा मुझे सर
Okay.
3 बोला टॉप 3
Education plan, did he ask about the education plan?
Yeah.
हाँ
Nida?
स्कूलिंग आई फॉरगॉट सर
Yeah, I just want, it's very important, right?
यस सर स्पेशल स्कूल और द रेगुलर स्कूल आई शुड हैव आस्क्ड that last 30 seconds sir that link got broken and again when you came back so then I forgot sir anyway
Very.
I missed it sir.
So he was studying first standard and special school, and there is no bullying going on. So all that I kept it actually for you. Okay.
Next time sir.
How can we ask about the abuse at the neglect? Yeah, it's
Can we ask like that someone new member introduced into the family and who is taking care of him other than you? Can we ask abuse under these 2 questions? Do you think your child is being maltreated?
Yeah. I think we can ask that. Two or more. One thing is like someone is taking care of the child other than the parents. I think that's a very important question. Then any change in behavior, I think we can ask that as a question. Any recent change in behavior? Is the child becoming a bit withdrawn? So any instances have you seen anywhere, any bruises? Anytime have you found? So I think those 2 or 3 questions might help us out. Um, and if sometimes the scenario will be like the mother will not be much interested in giving the history to you. A bit vague history will be there. So every time you will not get the relevant answers like this. I think then you can keep always neglect in the DD part.
Sir, I should have even asked about the sleep routine, right?
Yeah, so that's the general part. Usually
Yes, sir.
fever, activity, sleep, and weight. So always club it and you
Yes.
are. Many part of the MRCPCH scenarios, no, you get answers from these 4 actually.
Sir,
Fever,
one doubt
activity.
was there, sir. Like I read it in this MRCPCH, that document which they have posted on the website there. So there they have written it is not like you should explore all the points in the history. It is about how you approach the patient and how you handle it. It is not like you should take complete history in this much amount of time. What are your takes, sir, in this?
Yeah, that's what. If you miss a question and it is not going to influence your final differential diagnosis, you might escape actually, even if you
Okay, sir.
miss out 1 or 2 points. But
Okay.
if the system screening is where lies the clues for the differential diagnosis, and if we miss on that, I think there we might be
Agreed,
negative.
sir. Agreed, sir.
Otherwise, if sometimes they might not consider even if you miss out 1 or 2 points, no.
Yes,
that's
sir.
not a problem. Okay, Sheikh, but for a first presenter, you have done well, and you will keep preparing. You will be even better. So all
Thank
the
you, sir.
best
Thank
for
you.
you. All the best.
Yes, sir. Thank
We'll
you.
move on to the next part.
Sorry, sir. I logged out for a while. I don't know if you answered that question regarding future recurrence in the mother.
Future recurrences. Huh? I think regarding that, as you said, correct only. Like mosaicism risk is less. Translocation only. Usually, we look for translocation in the parents, and there is a chance of recurrence if there is translocation. And as you say, 2021 will have 100% recurrence. So carrier testing is very important. Then followed by antenatal. And even in antenatal, actually, nowadays they go for the non-invasive prenatal testing. You take the blood sample and look for, in the mother's itself, look for
Fetal
the
DNA.
fetal DNA. So
Yes, sir.
rather than straight away talking about chorionic villus sampling, you can talk about non-invasive prenatal testing.
Okay, sir.
Okay, so
Okay.
is it visible?
Yes, sir. It's visible.
Okay. Nida, right? Topic for the video station.
Who is?
Who is doing for video station? Nadia.
If nobody is here, then I can do if you allow me.
I think Nadia is there. Okay, Nida, you can do.
Okay, thank you.
So this is a station for 3 minutes plus 6 minutes of discussion. Okay. So
Okay.
you are now outside. You will be having this written in the sheet. So you are having very short information will be there. A 4-year-old child presenting with respiratory distress. So you will have a video. It runs for 10 seconds. You can listen as many times as possible for 3 minutes. Okay. Just whether you are able to hear the video sound alone, you just tell me. Video is audible? Nida, video is audible?
Yeah, but sound is a bit low.
Okay.
I cannot hear the sound. Anybody else can hear?
Yeah, we can hear the sound very clear.
Yeah, we
Yeah,
can hear
yeah,
this.
we can hear the sound. Yes.
Okay, let me this.
Nida, you're okay? Can start?
Yes. Can I see it for once more?
Yeah. Wait a second.
Okay. Okay.
Okay, Nida. So can you
So,
describe, you have 6 minutes. Can you describe what you saw?
okay, I have seen a 4 years old boy in a hospital setting, most likely in a hospital setting, in most probably his mother lab, and he is having a great difficulty in breathing, having a tracheal tug and the respiratory distress, and he is also having a noisy breathing on inspiration. Uh, Presently, no devices has been attached, and I've also noticed on the skin the vitiligo patches. I'm not sure about that, but there are some depigmented patches on the arms, and seems to be uh, seems to be in respiratory distress, most likely due to upper respiratory tract obstruction.
Okay. So what do you want to tell? What type of upper respiratory obstruction? Do you want to give a
Okay.
name?
Yeah. So I would like to take the history of regarding the onset, course, and duration of this illness. If it is acute and along with the fever or flu, then it may be a case of flu. And would like to take the history of any foreign body. Would like to take the history of vaccination for epiglottitis, and also it may be a case of bacterial tracheitis. But would have to take the detailed history, and also would like to uh, take the history of contact with a similar illness, travel history, and would like to examine the child without irritating the child, would like to take the saturation of this child, uh, would like to auscultate the chest to rule out any lower respiratory tract infection, and would uh, yes.
Okay. So what else in the examination you're looking for? So
An examination, I'm looking for any for the saturation, the I would rule out the dehydration. I would look into the hydration status. Would like to examine the chest for any V's or any added sounds to see if it is a lower respiratory tract problem, and would like to see check for any murmur if there's any chronic heart disease.
okay. So assume that it is an acute in onset, and there is a minimal fever, and the child. What's your diagnosis? It's a short onset with few coryzal symptoms and mild fever.
Uh,
So what's your main diagnosis?
I would keep the crew.
Okay, good. So how do you want to classify group?
Okay, crew can be classified into
Child's-
mild, moderate, and severe.
This child's which classification you want to put based on what findings?
He is having the severe crew because he is having the stridor at rest with severe respiratory distress. Saturation has not been shown, but I would like to keep him in the severe form, severe type.
Okay, severe type. Okay. How do you want to investigate this child?
Uh, I would not do any investigation right now. Instead, I would like to stabilize the child. Uh, 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 I would like to attach the oxygen, and along with that, if he's able to take orally, then I would give him dexamethasone, oral dose of dexamethasone. Involve my consultant will inform the ENT pediatric anesthetist, and if he's not able to take orally, then I would give start nebulizing with budesonide, and budesonide, and also if it does not work, then I can start NAB with adrenaline.
Okay. So, any local examination you want to do for this child to look into what exactly is happening?
I would not go for the throat examination because it can agitate the child, and I would not do any examination which hinders the calmness of the child.
Okay. What if it is a mild category? What will you do?
Mild category, for mild to moderate category, we can observe the child for 4 hours in the emergency. We can give oral dose of dexamethasone and can see whether he improves or not. And if he improves after 4 hours, he's maintaining saturation, he's improve after 4 hours, we can discharge the child on an oral dose of prednisolone, and along with full education of the parents on um, uh, on uh, um, on the red flags and
Okay. So what are the advice to the parents regarding red flags?
if there is depressed conscious level ruling, rider comes back again, the noisy breathing comes back again, he's not able to feed.
Okay. Okay, ma, time up. Nida, how did you do? Hello? Hello? Am I audible?
Yes, you are audible.
I
Yes,
think
sir, audible, sir.
everyone after finishing their moving out. So others can give the feedback how it went.
Sir, the DDs should have been more.
Okay. What else you want to add to the DDs?
Sir,
Yes,
apart,
I'm back.
Yeah, Nida. So first we will start with the Nida. So how did you do,
No,
Nida?
no, please, I won't, I don't know.
Okay.
sir,
No,
laryngotracheobronchitis and acute this epiglottitis, foreign body, and subglottic stenosis, and yeah, this could be the one, sir. Apart from that,
Hyperactive airway disease.
hyperactive airway disease, but that will be
Striders, just like
more of
in
wheeze, right?
hyperactive. Yes, sir.
It will be more of wheeze. Actually, here the most important thing is whether you are differentiating it as a strider or a wheeze. So if we put it into the wheeze part, then they will definitely mark us down because it's an inspiratory sound, right?
Laryngomalacia maybe, but it is not the age.
Yeah, age is not there, but chronic. I think Nida, you divided into two, right? Chronic and acute causes.
I didn't.
So maybe that part, if you do, you will have a broader. That's what Dr. Sheikh was saying.
Yeah,
That
yeah,
was less.
you're quite right. But I said in history, I would like to ask about onset, course, and duration. If this is not acute, because you replied to me that is acute. If it is not acute, then it may be a case of laryngomalacia, tracheomalacia, subglottic stenosis, laryngeal webs, vascular rings. There are plenty of causes of chronic. But you told me that it's a acute one. Yeah, but you are right. I should have mentioned.
Okay, because the examiner will give you the answers at the end. First, they will ask you what questions will you ask in the history. So then you
Okay,
have
yeah.
to tell both history for both the chronic as well as acute. Kabir wanted to say something. You are free to.
Okay, thank you so much, Dr. Nida. I think you should try and give yourself feedback. It always helps. You feel like we didn't do much, but we did well. Maybe
Yeah,
you should always
even
appreciate
I
you.
felt the way the management and all was bang on, Nida. So
Yeah,
your management
yeah,
part was good.
yeah. But in the description of the clinical signs, I think maybe she omitted some things. Like this child, when she was describing, she was saying she was having noisy breathing. And I think the examiner is actually waiting for her to mention whether this is a wheeze or this is a stridor, as you mentioned, but she just said noisy breathing, which is vague. So she might be marked down for that. Then other things obvious in the video was the child having an extended neck, and also his mouth open, and he was a bit drowsy. I don't know if
Yes,
she
you're right.
mentioned this when she
No,
was
no, no,
describing.
no. I didn't say the extended neck. I didn't
Yeah.
say a bit drowsy. I said
Yeah, I think
he's in a distress. Yeah.
sensorium part is very important, as Kabir says, no? Here the child
Yeah,
of his eyes, no? So the sensorium part is very important. And it supports your category also, because when I asked what is the category, so you just said only retractions. Sensorium is also a part which will favor the category, severe category. Then Kabir, anything else?
Okay, yeah, the management, I'm not sure what is this, a severe crew, or this is more likely of epiglottitis, or what do you call it, bacterial tracheitis. But I understand the management followed toward crew, but even that, when she was discussing her management, I think when she was mentioning stabilization, because either way, either this is a severe crew, or this is this child has impending complete upper airway obstruction. So immediately the anesthetist on call or ENT on call have to be you have to mention it when you when discussing your management. It's part of your stabilization. I think you forgot to
I
mention
mentioned.
this.
She
Oh, sorry.
No, I
mentioned,
mentioned.
actually. She mentioned
Sorry.
oxygen.
Okay.
Then immediately she said ENT and anesthetist. And here the most important two crux. Anything else you want to add to this?
No. I just want to apologize. I didn't hear that. Sorry.
Okay. And most important two things she did, like MRCPCH, no, they see whether you are a safe pediatrician. So one is I probed whether you look into the local region. So still she was adamant, no, I will not look into the throat. That's a very important point actually. I will not look into the throat. Then similarly, the one more point also, mother's lap. So that part I will try to manage the child in the mother's lap. So that's important. Then one more, she did.
Sir, we should call the anesthetist also, right? Just in case.
I think she mentioned. I think so. We need the team, the consult.
I mentioned.
On-call pediatrician, on-call ENT, and on-call anesthetist should be there to secure the airway. And anything else? I think otherwise.
Sir, one thing when you asked Dr. Nida that what investigations did you do? So she replied that I will not do any investigation. Rather, I will manage the kid, because the thing is that's very important. So should we mention about the investigations there, that now I will manage the kid and then later we can do ABG or look for the steeple siren, or we cannot, we have to mention this thing only what Nida.
Yeah, I think that is Rizwan, I think that is also very important. I wanted to say that only. In investigation also, we are not supposed to discomfort the child. So we have to keep the child comfortable, no? So any investigation which you are going to do is going to discomfort the child. So if we are very clear from the history, mild grade of fever, coryzal symptoms, child acute in onset, it's croup. So no need for any investigation here.
Thank you, sir. Thank you.
Otherwise, I think management part was good. So she also said the red flags when you will come back. So that part also she said good. I think overall she did fine. Nida, so when is your exam?
Thank you. But I missed some signs which I'm really
I
feeling
think
very guilty.
sensorium is a very important sign. So which
Yeah, sensorium, extended neck, and this I should have mentioned.
yeah. So when is your exam?
Can you send this video in the group if you are comfortable with that?
Sure.
The video you shown us.
Yeah,
in the group.
I will
Thank
share
you.
you.
Thank
I
you.
will share.
Thank you so
And
much. Thank you so
Dr.
much.
Nida, Dr. Nida, in exam you'll be seeing it more than this. 3 minutes you'll be seeing multiple times, so maybe you will pick it in a better way that time.
Yeah. Audio will be also
I
clear.
have seen multiple times and didn't mention. I have seen multiple times, but I couldn't mention.
Actually, it's a frequently asked scenario. One of my colleague actually, that exam stress changes things actually. She immediately blurted out actually, I will examine the throat. So sometimes during the exam stress, no. So then she came out and was saying, "What did I say? Why did I even say that?" No. So during that stress time, you will be a bit different. Okay.
Yeah, sir, I have a question. In video, I heard that there is a biphasic strider. So it was a inspiratory strider or it's a biphasic?
I think inspiratory was more. Maybe expiratory
Inspiratory.
biphasic suggests the severity actually. If it's more severe, it means actually. Okay. So before we end up, thank you for the patient listening. And we have two things going on. Those who are going for exams very sooner, you can try out the mocks. It's a way of boosting your confidence. So you can take the mocks with us. We are here to support you. Similarly, those who are just starting, you can take a long course where we can have more deeper interaction with all of you. So we will go step by step every week, topic by topic. We can go in detail. So we are here to support you for the exams. So happy reading. Any doubts? Can tell, or we can close the session. Okay. Thank you. Thank you all.
Thank you.